Hi, everyone. I just wanted to thank everyone for allowing me to be here. This is a great opportunity. I'm really excited. So yeah, I'm a medical student from Emory University. Let's talk about high-frequency ultrasound as an evaluative, diagnostic, and laser treatment planning tool for scars. I have no disclosures. Now, high-frequency ultrasound, if you've heard of it before, ultrasound has a lot of applications, but in this scenario, from 20 megahertz all the way up to 70 in some cases, we can get really clear images of the skin. And these are a few millimeters deep, and these images are non-invasive. They can be done in real time to superficially recognize these depths and structures. Now, in our study, this is a case series of 22 scars, and we subdivided these scars and compared the scar types to distinguish them between themselves and describe their architecture. So we divided these up into surgical scars, which comprised of well-healed and contracted scars, traumatic scars, and keloids. So for surgical scars that are linear and well-healed, these actually resemble normal skin under high-frequency ultrasound. And if we take a look at the image on the right over here, this is the epidermal entry echo. This is hyperechoic. So collagen, anything that is reflective appears slightly brighter, and hypoechoic is where images such as water are more absorptive and present as hypoechoic on these images. So yeah, let's continue describing it. So we have the epidermal entry echo, and then overall we have this uniform overall distribution of parallel collagen bundles that are parallel to the dermal epidermal junction. And this is consistent with histopathology, and we can actually see this in a few different cases here. Now in comparison, contracted scars are a little different. We have a little more rugged appearance. These collagen bundles are a little thicker, and we can make out the inferior border very clearly, whether or not we're going from the vertical cross-section or the horizontal cross-section. Now over here, you can actually see the whorled appearance that kind of shoves the upper tissue up, and we can actually see that contracture scar right here. Here's some other examples. Now, traumatic scars. From the top, already things are looking different. We have the epidermis that is non-continuous, and it's because it's hyperechoic, and then suddenly it's not, continues on. And in the body of the lesion, there's varied intensity as well. We have hyperechoic regions, and then we have a posterior acoustic shadow here with an irregular deep border. Now, in comparison to keloids, we have this same posterior acoustic shadow, but with a very clear defined inferior border. In addition, we found these coalescing arches here that were characteristic of all the keloids. Basically, in what happened, we have these exophytic structures, and the sound interacts with the increased density of the keloid, and then the sound interacts with the angle of that tissue, and creating these kind of arches all over the place. And we can see this. We saw this between our keloids. Now, so our study, our case series showed that high-frequency ultrasound can be used to evaluate, differentiate different scar types, and hopefully one day will be used more in the diagnosis of these lesions. And this is clinically useful today because it can provide useful information for scar treatment. Now, laser therapy for scar treatment is well known, as I'm sure you know. And over the past decade, many studies use this technology to assess the efficacy of laser treatments by non-invasively measuring lesion depth. However, it's currently not the standard to use this technology before the laser treatment of scars. And this is something I'd like to end with and ask you guys to consider today, because this may improve outcomes. Now, one study in 2020 by Esther Fisher and authors found that for a fractionated ablative CO2 laser, there were worse outcomes for fully penetrated traumatic burn scars, and improved outcomes when it was a little less, at 51 to 75%. So we'd like to maybe ask you to consider to provide a tailored approach for difficult lesions where you can actually non-invasively explore the lesion in real time and plan your treatment depths. And this, of course, will require further research, implementation, training, and integrating with current systems. But I'm leaving you with that. Thank you all for letting me to be here. I'm very excited. Thank you all so much.